physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Together, we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about 12 daily habits that contribute to or maybe even cause your knee pain. Let's get right into it, Brad.
So that would be like taking a hammer and hitting your knee?
That would do it. These are simpler than that.
Oh, good.
One is just sitting with the knee greater than 90 degrees, which is a right angle.
Right.
So if you sit at a chair all day and you're like this and you got your knees back, or even if you sit on your legs, I know you've done this, right?
Like, yeah.
Like, look how much stress you're putting on a knee. You got extreme flexion. You're really grinding the joint. So even this light, it seems innocuous, doesn't it? Doesn't seem like
Ooh,
it's
innocuous. Yes. Yeah, it's like, well, what's the big deal? Well, I think if you sit like that for short periods of time and then you move
That's
your
fine,
leg,
right.
but for hours at a time.
Right. So over time, you really want to be more like this or like this.
Better circulation as well, down to
Right.
your feet and
And
et
it's
cetera.
better just to do this once in a while.
Sure, get a little motion.
Yep. All right. Standing with your knees locked.
I don't do that. I never had a problem
I
with
had
it.
big trouble. when I
Yeah,
was-
because my knees inherently don't hyperextend at all, so it's kind of normal for mine to be flexed. That's just nice.
I think when I used to go like this because I was tall.
Yeah.
and I
Oh, you're
would try to
going
bring
through
myself
doors?
down. Yeah. No, I try to be down on the same level of people. I would stand with my knees extended.
oh, physically you
yeah.
meant.
And I remember a therapist pointed it out to me when I was in school.
Yeah.
He goes, "Boy, you're really hyperextending your knees there." And I'm like, "Really?"
Do yours kind of lock backwards a little bit? You
They
can
they
feel
will
it?
if I do it. I
Yeah.
don't do it now. I stand with my knees slightly bent. And that really helps to have one foot right in front of the other.
Sure.
And just put a slight bend to the knee. That just makes it a lot easier. Another one, you see this with new parents when they like hold their toddler or their baby on their hip,
Yeah.
and they're leaning all on one leg.
You kind of get that, hook them in the hip.
It
It works out pretty
stabilizes.
good.
Right.
Yeah, you can just,
But it puts a lot of pressure on one leg, especially if you're having problems with that one leg.
yeah. And it's that cool stance, too.
It'd
You
be
know,
the right
you look
leg.
cool when you just stand like this.
No, you don't.
Well, just some people do.
All right. How about when you lie down at night? I even said it correctly, Brad.
Oh, yes.
Now, I do this. I follow this religiously, Brad.
What? I don't know what you're talking about.
When I sleep on my back,
oh, yeah.
I put a pillow between my legs so my legs aren't straight all night
Where
long.
do you keep the pillow?
It's right here.
You keep it on top of you?
No, I leave it right
Under
toward
the-
my knees.
Underneath the blanket.
Yeah, underneath the blanket.
Oh, wow.
Because watch this.
Okay.
Now, if I'm going to lie on my side,
Yeah.
I'm going to take it and I put it between my knees and I go like this.
Boy, I tell you that I don't do that because I don't lie on my side very much.
Uh-huh.
But I've done that, and it's like that really feels good. Yeah.
Yeah, and it stops the knees from knocking together and
Yeah.
get problems. So
You get those bony knees.
it works really well for me. It was something I was having trouble with, and it took away any issues I had.
Sure.
So inactivity. So people think that a lot of times when my knee hurts, it's best to give it a rest, right?
Yeah.
Or no movement at all. And think about it when you're in childhood and you're moving all the time. Of course, you have no knee pain because you're getting lots of natural fluid, lubricant,
Yes, the
to the knee.
synovial fluid. Mm-hmm.
and you're getting lots of blood flow. So movement is needed to increase blood flow and lubrication to the knee.
Sure.
So you don't want to be still. We like biking, especially in nature. You get
Sure.
a double benefit.
Yep. More
Just-
relaxing.
You can do some of these.
Yep. LEQs, long arc
Yep.
quads, or just kicks, as some people
Walking
like to call
is
it.
fine.
Yep. Boy, if you can get in water and do some water exercise,
Right.
that's really good because the weight bearing is so much less. I know that's not an option for a lot of people.
Another daily habit is if you don't do any strengthening at all to your knees and the muscle around them, that could be a problem. You just need to follow our program. Why don't we talk about our programs right now, Brad?
Oh, yes.
If you go to bobandbrad.com, go to the
That's our
program
website.
section,
Yeah.
you'll find one on knee pain, and this video is a part of that.
Right.
It's a whole series of videos on knee pain. And one of the videos is called How to Strengthen an Arthritic or Painful Knee.
Right.
We filmed it.
Yep, it's about 10 minutes long. You watch the film. There's a PDF printout. Click on it. Print it out. It has a review of the whole video and pictures of the exercises. It's a win-win situation. We don't even ask for your email.
Or any money. It's
Well,
all free.
Right, exactly. I was going to say if they want to donate, but we don't even have a donation site.
We don't want you donating.
I'm just kidding. Yeah. Anyway, what do you got? Another one?
Okay, number 9.
Number 9.
If you stand let's say you stand for a living. You got to stand
Right.
all day long. You should take a break every 30 minutes or so, sit on a chair, and actually bend your knee and flex it with a 5-second stretch. Do it 5 times each side.
Yep. Oh, I just cracked mine. No pain, so that's good.
Sometimes if you're on a chair, you got to slide your butt forward a little bit so that you have room.
I can
Brad will show that.
demonstrate that.
Sure.
Even just a stool to sit on if you don't have a chair to sit all the way down, but a stool to take some weight off the knee. It's a little bit harder to do this on a tall stool.
All right. Habit number 11, just allowing the knees to get tight. Let's say you sit a lot. When you sit, your knees are bent the whole time. Your knees lose the ability to straighten. So you may want to straighten the knees. We'll show you in another video in the program section.
Oh, how to stretch.
How to stretch the knees.
Yeah.
So, and number 12, I hate to bring this up because people who are overweight know that they are, and they know that's a problem. But obviously, if you can lose some weight, you're putting less stress on the knees.
Sure. Yep.
And also, the habit that I see a lot of elderly people do, they have their purse, a lot of elderly women, and that purse weighs like a ton. I mean, I pick it up, and that's the first thing I'll do when they see a patient. I would pick up their purse to move it out of the way.
Yeah.
Like, oh my gosh, what do you got in
you
there?
dump it out and say, this is better?
Yeah, that's it. Get rid of that stuff. But really, you try to lighten it up, because if you're having knee pain, even that extra 10 pounds can make a big difference. What, 10
10
some more
pound
10
purse?
pounds?
You weigh them or something?
Well, I don't know. They had a weight on there like this. I don't know.
I know my mother, her memory's not the best, but she never forgets her purse.
She doesn't.
Oh, that is one thing.
Interesting.
Yeah.
I can't tell you how many times we had to drive back somewhere to find my wife's purse. Oh, my God.
Really?
Yeah, one time she left it on a car, and it fell off and didn't know
You
it.
mean up on the hood?
Yeah.
Or the yeah.
Yeah.
Yeah, well, one thing, at least you're,
It's a trial.
you need to get mad
living
about
with me
that.
too.
Yeah,
So I realize it balances out.
it's like leaving your cell phone on the car.
Yeah, you done that?
No,
Oh.
no.
I haven't done that one. I put maybe
I
a
could,
drink
though.
on the car.
Yeah, I could. Well, that was when you were younger. Though.
Yeah.
We got to get off.
All
of-
right. Thanks for watching.